9 months of sleepless nights. Imagine how traumatic it would be for you to undergo the same procedure again, to undergo an abortion immediately after delivery, right? Not a very good idea, right? Now, this is where post delivery contraception comes in. Hello, friends. A warm welcome to you. I am Dr. Shaily. I'm a gynecologist, obstetrician, and infertility specialist practicing at Andheri East Jain Maternity General Nursing Home. So, friends, firstly, congratulations on becoming a new mom. I'm sure you must have had a great deal of 9 months of sleepless nights, 9 months of abdominal pain, labor pains, difficult delivery, and then feeding the baby. It's quite traumatic, right? So I'm sure immediately getting pregnant would not be a good idea. Now that's where post-delivery contraception comes in, right? So let's discuss a few points, a few relevant points on what is post-delivery contraception. So, practicing contraceptive measures immediately after delivery will offer you chances of not getting pregnant, not having an unwanted pregnancy. What are the options that are there with us? Number one is progesterone only pill. Now, these are pills called Cerazette, which are available in the market. They have to be taken on a daily basis, continuously from the time you start practicing contraception. It has to be taken daily. You cannot stop these tablets in between. Okay, the moment you stop these tablets, the effect goes away. So it has to be taken continuously. Okay, now one side effect that is associated with this is that it can cause irregular menses. Okay, and it has to be taken till you want another baby. All right, now the second option that is available is copper teas. Now, copper tea will give you a very good 100% contraception. Okay, copper teas can be inserted as early as 6 weeks post delivery. They offer you 100% effective contraception. They can be inserted for 3 years or 5 years or even 10 years. In fact, the effect of copper tea even goes away the moment you remove the copper tea. So, suppose if you want to plan a pregnancy, let's say 2 years or 3 years after you've had your first delivery, you can get the copper tea removed and the effect goes away and you can start planning another pregnancy, right? Then coming to something called as injections, medroxyprogesterone acetate injections. Now these are injections which have to be taken once in every 3 months. Now you can continue to take these injections till the time you do not want a pregnancy. Yeah, the only drawback associated with these injections is that suppose if you want to plan a pregnancy after, let's say, 2 years or 3 years after your delivery, and you are on these injections, then you have to stop these injections beforehand, because after you stop these injections you are going to have a good amount of waiting period of almost 10 months before you can actually start planning a pregnancy, right? Then coming to something which is very important, barrier contraception. Now, why should boys have all the fun and why should girls undergo all the pain? Give them a chance to offer you service, right? So condoms, sasta sundar tikau. Please make use of condoms once you start getting physically intimate with your partner, right? Condoms are very freely available. The only problem with condoms is that it has a high failure rate. So the couples using condoms should definitely make sure that the condom is not ruptured and there is no leakage in the condom. Okay. Then coming to emergency contraception. Now, what if you've had an episode of unprotected intercourse? What after that? So, what are the things that you can use in cases of unprotected intercourse? Number one is an LNG pill. Now, this is a levonorgestrel pill, also very freely available as I pill in the market. You can take this pill at least 72 hours within an episode of unprotected intercourse. Okay, and this is one option that is available. The only problem is that this might cause little irregularity of menses. Okay, another option is inserting a copper T within 5 days of having an unprotected intercourse. Okay, then coming to what are the permanent solutions, what are the permanent options available for not having an unwanted pregnancy. So this applies to those ladies whose family has is complete. For example, if there is a lady who has had two deliveries, she does not plan to have any more pregnancies at all, then she can go in for a female sterilization operation. This is called as a tubal ligation operation, which can be done as early as on the third day post delivery, or it can be done anytime later. This can be either a small open surgery, or it can also be done laparoscopically. Okay. Now there is also a sterilization operation that is done for males, that is called as a non-scalpel vasectomy. Lots and lots of respect for all those men who offer to undergo this non-scalpel vasectomy, which is a procedure, a short procedure, hardly a 5-10 minute procedure. And after that, there is no tension of having any unwanted pregnancies. In fact, these are men who would, who would not want to see their spouses in pain to go through that entire process of medical abortion or a surgical abortion. So hats off to all those men who actually opt for non-scalpel vasectomy. So these are the various options that are available with us for avoiding an unwanted pregnancy. Also, there is something called as a tablet called Today. Now, this tablet is it has a sponge-like effect, and it has spermicidal action. That means it prevents the sperms from entering the reproductive tract. Okay, so this can also be used 15 minutes before having intercourse. That is, if at all you're not comfortable with any of the above options that we discussed for contraception, then this is one tablet Today. Remember the word Today, it's very easy to remember, which is freely available in the market. So you can make use of these tablets 15 minutes before having intercourse. So I hope I have spoken on relevant points, and I hope this is useful to you, and I hope that you apply to these things and try to avoid unwanted pregnancies. And it is I would like to give you a small take home message. It is better to discuss these small issues with your gynecologist, rather than ignoring it and then going through the entire tedious effect of tedious procedure of medical abortion or surgical abortions. I hope I have done my bit in controlling the population outburst of this country. And if you have any questions, please put them in the chat box, and I'll be very happy to answer them. Or you can also send me a mail on dr.shaily@gmail.com. Okay, so I think I already have a few questions. Nisha wants to know that my baby is 3 months old. Is it okay to do sex? Will that affect on my breastfeeding? Nisha, you can absolutely have sex, but it should not be an unprotected intercourse. Remember that after 3 months of delivery, you are very much ovulating. You have a chance of getting pregnant. You can use those progesterone only pills. Okay, there are a lot of tablets available in the market. In fact, there is one new tablet that has come up, which is called Dronis P, which is also very easily available, and this you can safely take during breastfeeding. Mohan wants to know, my wife is worried about pregnancy, but it's not possible for me to. Okay, how should I make her understand? So, Mohan, you have to make your wife comfortable. You have to let her know that post delivery, now, you can very well have intercourse. It is not going to hurt her. She doesn't have to be scared. With the right contraception, you can either use condoms, or, in fact, copper T is a very good option. It does not interfere with relations at all. Pratiksha wants to know, are these tablets safe? Yes, Pratiksha, there are very safe tablets in the market which can be very safely taken during breastfeeding. It will not be passed on to your baby. We are not giving you combined contraceptive pills. These contraceptive pills are actually only progesterone, and they do not harm your baby. Does hormonal birth control make me gain weight? So these hormonal birth control pills do have little water retention, but it's very temporary. And plus, nowadays, the tablets that are available are very low dose tablets. See, that's the reason you have early breakthrough bleeding when you have these tablets. If you skip these tablets, you start bleeding. So that's because these are very low dose pills, but they have minimal side effects. So you need not worry. You can absolutely take them. Okay, so what if in case you get pregnant? Now in case if you get pregnant, as I suggested, you have to take emergency contraceptive measures. So this LNG pill that I spoke about, which is freely available as I pill, there are in fact a lot of companies which have this one of them is I pill, which can be safely taken within 72 hours of an unprotected intercourse. Yes. So, in fact, you can also insert a copy, which can be inserted within 5 days of an unprotected intercourse. So, I think there are a lot of options available. But yeah, please consult your gynecologist and then do the required things. Uh, Prachi wants to know. I do not feel like free to do. Okay, now my son is 3 years old. See, Prachi, it's very normal to have a loss of libido post delivery. It happens with every female. So please do not think that there's anything wrong with you. See, because you are so tired taking care of yourself, of the house, of the little baby, that you do have a loss of libido. But rest assured, all these things are going to come back. These are temporary hormonal changes which are going to revert back, and you are going to have your libido back. Don't worry. In fact, there are a lot of medicines available in the market which can increase your libido. And I would advise you to very liberally make use of sex videos also, in cases, because this is a natural process, and every lady faces it, so you don't even have to be embarrassed about it. You can very proudly discuss it with your gynecologist and she will explain. Any other questions? Great. So I think Anuradha, okay. Can I do sex after my delivery? Anuradha, yes, you can. See, but we normally advise to avoid relations for the first 6 weeks post delivery. The reason being that we don't want to expose you to infection. Okay, see, a lot of times during delivery, you get stitches. Now, these stitches usually heal within 1 week. Okay, but sometimes some stitches might take some time to heal, some stitches might open up. So when you're becoming sexually active a little early, you are basically exposed to a lot of infections. Okay, and that is why even if you use condoms, yes, you can get protection from infection, but it's going to be a little uncomfortable for you. Plus, even during cesareans, there are stitches on the uterus. So we normally recommend a gap of 6 weeks. After 6 weeks, you can very well get sexually active, and of course with using the right contraception. Okay, so somebody wants to know copper tea. I am scared. Okay, so there's nothing to be scared about copper tea. In fact, there are a lot of people who have myths about copper tea, who are not comfortable putting copper tea. They feel that they will gain weight by putting copper tea. Absolutely not. Copper tea is, see, you have a metal on your body. Don't you wear earrings? Does it make you put on weight? No. So similarly, even a copper tea is just getting positioned inside your uterus, and it is giving you 100% contraception. So it is very safe. You can insert a copper T. It's not going to interfere with you having relations at all. And the only thing that you can face with copper T is that, let's say in the first 1 or 2 months after inserting copper T, you might have little heavy periods, but that's it. That's because the body is adapting to a new thing, and after that it does regularize on its own gradually. So it's the best thing you can have. Yes, copper T has to be inserted in the hospital. You have to consult your gynecologist, and it has to be done in the hospital setting. Okay, it won't. It's you cannot put it on your own. Copper T has to be inserted by the doctor, but it's hardly a 5-10 minute job. You need to see your gynecologist, get a copper T inserted, and be feel free for the next couple of years. Rest assured, the failure rate of copper T is minimal. It's hardly 1 in 1,000 people. So I hope I have touched on all the important points. Do we have any more questions? Okay. Thank you, Baby Chakra. Thank you for having me online. I'll be glad to offer my services again on Baby Chakra.